implant is what we would call a single tooth replacement. And so that if you unfortunately have a tooth that needs to come out, or in some cases, some patients don't develop that adult tooth, a dental implant is a really great replacement option for that tooth. The biggest benefit for replacing a tooth with an implant would be, it's going to help support the teeth around it. And so without a tooth present, the other teeth around it have to take up the brunt of the work that tooth would have been doing. From an aesthetic standpoint, if you're missing a tooth, you're going to see that space a lot of times when you smile. And so a dental implant will help restore your smile. Anyone missing a tooth is potentially a candidate for an implant. So there are some certain medical conditions that might inhibit you getting an implant, but I would say 98% of Americans, if you're missing a tooth, you would benefit from a dental implant. And so the implant process, it is when you're here, relatively straightforward. The biggest thing with implants is we have to wait for you to heal. And so depending on, the case, it could be anywhere from a 3-month process to, 8 to 10 month process. So implants have really become the gold standard in dentistry. In the past, we would have to do what's called a bridge to replace a tooth, which is a little aggressive because we have to crown the teeth on either side of the space there, and it's all one piece. And so if there's ever a problem in the area, all of a sudden it's a 3-tooth problem instead of a 1-tooth problem. And then again, having to prep those teeth to make crowns on them is a little aggressive, especially if there's nothing wrong with those teeth to begin with. And so really that's why implants have become the gold standard, because we don't have to affect the teeth on either side. Another big advantage is implants are very successful. They have one of the smallest failure rates of anything that we do here in the office. And so modern technology has really made implants a much more predictable process. And so we have a CBCT, which will take a 3D image of your bone and the teeth around where the implant is going to be placed. We also have a digital scanner that will scan your teeth, and we're able to design what tooth we want to replace the missing tooth, and then design an implant to be in the ideal position to create that new tooth. And so with all our digital technology, we're able to digitally plan where the implant's going to go. And then we have a 3D printer that will print out a surgical guide so we can place that implant right where we design it on the computer. That makes the whole process a lot more predictable, a lot more streamlined, and sets that up for a much better success for you as a patient.